Our team coverage begins tonight with CBS 4's Bobeth Yates live at Jackson Memorial Hospital. Cases are up, but the CDC loosens its quarantine guidelines. Bobeth, some might wonder if that is counterintuitive.
Exactly, Jim. You know, you mentioned the increased number of people that are getting the virus, but at the same time, the CDC just this week announced they are reducing the number of time it takes to quarantine once you get it. So what is this all about? Many people are skeptical, but one doctor explains it to us.
COVID-19 as a result of Delta is different than COVID-19 as a result of Omicron.
Local Dr. Bernard Ashby says the most recent variant of coronavirus is almost like a new virus with different infection rates, symptoms, and viral load.
This particular variant has a much shorter incubation period, which means that from when you're exposed to when you start to have symptoms, that time is generally about 2 to 3 days, which is different from the 3 to 5 days that we saw in Delta.
Dr. Ashby says that means those who get Omicron can transmit the virus for just about a 5-day window. And now the CDC has adjusted their quarantine guidelines to match the virus cycle.
We are standing on the shoulders of 2 years of science. We know that after 5 days, people are much less likely to transmit the virus, and that masking further reduces that risk.
With that in mind, the CDC shortened the recommended time for isolation, saying you only have to quarantine for 5 days versus the previous 10-day recommendation. And if you've been exposed or are asymptomatic, you just have to wear a mask for an additional 5 days around others.
If you look at the previous recommendations, they went well beyond what we considered the infectious window, and they had a much more conservative take. But because of the huge losses in labor, particularly in the healthcare sector, that almost certainly influenced the decision to be more liberal and actually shorten that window from 10 to 5 days.
In addition to the healthcare sector, many industries have seen an increased worker shortage. That includes those who feel uncomfortable getting back into the workforce and those who are ill from the virus. And Ashby adds he believes that also played a factor with the new COVID-19 guidelines.
With these staff shortages, you have collateral damage. So you have to walk this balance. And the CDC tried to thread that needle the best they could.
Now, with that said, I'm told that Omicron is a lot more transmissible than the previous variants of the COVID-19 virus. Now, that means if you cannot find a test or a way to verify if you have the virus, you should still be taking precautions. Dr. Ashby told me that anyone who is in or think they have been around someone that has gotten the virus, they should be taking all the precautions like wearing a mask, washing your hands, and making sure that you are not infected or infecting others. Live at Jackson Memorial, Bobeth Yates, CBS 4 News Tonight.